So enter the room, hand hygiene. I'm going to put clean gloves on so that I can clean my patient with warm soap and water. If their perineal area is very dirty, has a lot of drainage, anything like that, I want to make sure I've got a good clean surface and area before I start. So I would do that. I would then take those dirty gloves off and throw them away. I'm going to open my kit. Take my bag. In here are 3 Castile wipes that I could clean my patient, and if I utilize these, I would put on a clean set of gloves. I would clean outside, inside, and down the middle with these 3 wipes. Then I'm going to take my hand sanitizer. I'll remove this. I'm going to set this aside to put on my bag later. I'm going to take this drape, open it shiny side down, not allowing it to touch my skin or anywhere else. I'm going to grab this at the top, and I'm going to place it down between my patient's legs without letting my sterile hands touch my patient. I'm going to take this additional drape that we can use for males, and I'm going to throw it in the trash. Open my iodine and pour it down on my gauze, or my swabs. Take my syringe, connect it to my Foley, take my lubricant, squeeze it out in this part of the container. I'm going to get my catheter out of the blue packaging, keeping control of the catheter as I remove it. And then placing the tip of my catheter in the lubricant. At this point, I'm ready to come over to my patient, and I face my catheter towards my patient. I take my non-dominant hand, take one wipe, come down away from me, second swab, third swab, down the middle. I'm going to take my catheter, and I'm going to insert until I have urine return. I'm going to take my non-dominant hand and inflate my bulb, keeping pressure on the plunger. I'm going to now release with my sterile hand and disconnect. At this point, the sterile procedure is over. I can slide my catheter back slightly till I hit resistance, then re-advance it a little bit so that the bulb isn't sitting right on the urethra. I'm going to take my bag, get my stat lock. I'm going to connect it correctly. Place it on my patient's leg with slack on the catheter. and then hang my bag below the level of the patient's bladder. When I remove my catheter, I'm going to disconnect it from my stat lock. I am going to take a washcloth and my syringe. I'm going to withdraw the 10 mLs of water. I'm going to flush that out, and I'm going to reconnect just to be sure I've gotten rid of all of the water. It's pulling back air, so I know I'm good. I'm going to take my washcloth. I'm going to place it here. I'm going to tell the patient to take a deep breath, breathe out, and I'm going to slide the catheter out into my washcloth. And then I would discard everything.